Great. Hi, everybody. Thank you so much for joining us. We're going to give everybody about a minute to get on the webinar today. We have a lot of folks who are going to be participating with us. So we'll give everybody just a few minutes to get on and then we'll get started. As folks log on, we're just giving everybody just a minute to get on, and then we'll go ahead and get started. Thank you all for joining. And we also know that the chat is currently disabled. We're working on getting that enabled for everybody. Once we get the chat working, we'll be asking you all to tell us a little bit about yourselves, what organization you're with, what continuum of care you're with, and your name and your pronouns. So we'll get that moving along in just a moment. I think we're going to go ahead and get started. People are still logging on, but let's go ahead and get started. Again, thank you so much for joining us today. Good afternoon. Welcome to today's webinar on HUD's special notice of funding opportunity to address rural homelessness and the new stability voucher program, with an emphasis today on the rural part of that work. Can I go to the next slide, please? My name is Ann Oliva. I am the CEO of the National Alliance to End Homelessness, and I'm joined today by Christy Schulenberg from the Alliance team, as well as Leslie Strauss from the Housing Assistance Council and Eric Oberdorfer from the National Association of Housing and Redevelopment Officials. We have about 75 minutes together today, and we'll present an overview of how we hope to see continuums of care approaching this Nofo, along with some key details you should be thinking about as you prepare your plan and your application. And also how you should think about this opportunity and the opportunity to pair the resources that are available in the Notice of Funding Opportunity with the stability vouchers HUD recently issued a notice about. We'll be talking about all of those things today. We intend to take questions at the end, so please feel free to put questions in the chat when the chat becomes enabled. And hopefully we'll be taking care of that in just a minute. I know that we're having a couple of technical difficulties on that. And so the last thing I want to note here before we get started, and I'll probably say this a couple of times, is just we are not the U.S. Department of Housing and Urban Development. We're providing ideas and overview information today, but technical questions really need to be submitted to HUD, both on the Nofo and on the vouchers. And everybody should read the Nofo and the stability voucher notice very carefully as you proceed with your applications and your planning process. Can I go to the next slide, please? So first, I want to review some housekeeping items that we think are important as we go forward. All attendees other than our speakers are muted. So please use the chat box when it gets enabled to share information and ideas amongst yourselves. I think it's important to note that we have had a recent incident where some racist statements were being made in the chat during another webinar. And as a result, the Alliance has changed our protocols so that we have a chat monitor on with us today. Her name is Caitlin, and she's going to be checking out the chat when it gets enabled and the Q&A box. This webinar is intended to be a safe space where we facilitate discussion and learning between and among participants and presenters. And so we will expel any participant who's making racist or offensive remarks in the chat or in the Q&A during today's session. I also want to again mention that we're not HUD. Questions for HUD can be directed to an email address that's COCNOFO, that's COCNOFO @HUD.gov. And we'll be putting some links in the chat for the eSNAPS navigation guide and the HUD competition page for your reference when we get the chat enabled. And then last thing, this session is being recorded and will be made available on the Alliance's website. The PowerPoint will also be available after today's session. So again, we're working on a couple of things around the chat. If the chat isn't enabled and you have some questions, the Q&A box is enabled, so you can use that function to send some questions to us for us to take a look at. So let's go to the next slide. Before we talk through some of the key technical information everyone needs to be clear on, we wanted to take a moment to talk about what this Nofo represents in terms of opportunity. Next slide, please. We think this Nofo represents an opportunity in 3 key ways. The first thing I want to note is that funding for this Notice of Funding opportunity was not specifically appropriated for this purpose. And I raise this point, and it's important for you to know, because in cases like the Youth Homelessness Demonstration Program or the Domestic Violence Set-Aside, those cases are directed by Congress. Congress directs HUD to set aside funding for a particular purpose. And that's not the case for this Notice of Funding opportunity, which is really funded from money that's been recaptured from other continuum of care grants over time. So in other words, HUD is choosing to spend their recaptured funds in this way, which I think is a strong cue for communities that this is a priority area for the department and for the administration. Therefore, communities should really see this Nofo as a driver to develop a comprehensive plan on unsheltered homelessness or on addressing rural homelessness, or both, even if you aren't sure you want to apply, or if you aren't sure that your continuum of care will be competitive for this limited funding. I suspect, although obviously I can't be 100% certain of HUD's motivation, but I suspect that having this type of plan in place, both unsheltered and rural, will not only help people experiencing homelessness in your community, but will help you be more responsive to the regular, normal continuum of care application in the future. We also see this Nofo as a great opportunity to build capacity in rural and tribal areas that haven't received COC funding previously and that have high levels of need. But likely most importantly, I want to turn your attention to the middle square on this slide. There's a growing and very vocal movement in some state and local areas by hostile groups or ill-informed officials to promote ordinances and laws that really are pro-criminalization, anti-housing first, and anti-evidence. This Nofo, both in cities and in rural areas, presents the right alternative to those types of measures. And we really think about using this as an opportunity to create momentum towards reversing course on those punitive, racist, and traumatizing practices and policies, and instead really double down on what we know works. Next slide, please. I know Leslie, I'm not going to spend a ton of time here. Leslie is going to go into more detail here, but there's about $322 million available through this Nofo. The rural homelessness set aside is $54.5 million made available to projects that serve rural areas. And if you look at the language that HUD uses in this Nofo, you can see that they include tribal areas as part of this set aside. Especially given that most of those areas have never been served by the COC program due to previous statutory limitations that have now been changed, so that tribal nations can receive funding in the COC program. Next slide, please. We are well into this process for most communities, and here are some of the key dates that COCs have to hit to be competitive for these funds. Obviously, the Nofo was released in June. September 20th, which is just a few days away, are when project applications have to be submitted to the continuum of care. October 5th is when COCs have to notify applicants about whether their projects are accepted and ranked. October 18th is when the COC has to post all parts of the special Nofo consolidated application online, and the submission date is October 20th. So these are important dates that the COCs need to hit in order to be competitive again for this funding opportunity. Next slide, please. So here at the Alliance, we've developed a number of principles that we think are important for communities to consider as they go through this process. The Alliance recommends that communities and programs be urgent, equitable, and intentional. We hope to see COCs and programs aligning their applications to meet the needs of the individuals or families in your community, while also utilizing housing first principles and practices. This work must be done in collaboration with partners, including but not limited to healthcare providers, housing providers, older adults, older adult focused programs and providers, tribal entities, and the VA. Again, this isn't an exhaustive list, but it's meant to provide some broad principles to follow for your decision-making and program design. Next slide, please. And I want to take a moment to discuss equity for marginalized people and why it's important for COCs and projects to center equity when developing these applications. As you all know, most minority groups are overrepresented in the homelessness system and generally experience homelessness at higher rates than white people. Overrepresentation also threads through other communities like the LGBTQ community and people with disabilities, and is also rooted in discrimination. Understanding the causes of disproportionality in homelessness, especially racial and ethnic disproportionality, requires an analysis of all of these systemic racial discriminatory practices. And these realities continue to drive inequities that we see in our system today. So they need to be centered when you're designing programs, whether it's in an urban area, a suburban area, or a rural area, so that those programs work for everyone. Next slide. We need to build partnerships with feeder systems like the criminal legal system, child welfare, and others, because it's important to address the inequities that we see in the homeless system, and it has an impact on scoring in this special competition. I'm going to talk about that in just a minute. We have to make sure that we're not perpetuating those inequities through how we prioritize what types of services are offered, where they're offered, and who is providing or informing services delivery. So in the Nofo, next slide, please. In the Nofo, you can see by the points related to equity that HUD is placing more emphasis in this area. So we thought it was important to talk about this. The Nofo awards points for activities like inclusion, the diversity of stakeholders, the engagement of organizations that serve culturally specific communities experiencing homelessness, and others. And some examples include points for outreach strategies that are culturally appropriate and that involve people with lived experience and expertise as paid staff. COCs can get up to 5 points for including people with lived experience in the COC process, and up to 8 points for supporting underserved populations, including siting projects on tribal lands. The Alliance has a number of tools that you can use to help you center equity in your proposals. Caitlin, I think, is going to put a couple of links into the chat or the Q&A. Not sure what's happening with that because I can't actually see it, but we'll put some of those links and make them available to you so you can use some of the Alliance's tools. Next slide, please. And then lastly, before I turn it over to Leslie, I wanted to take one more moment to talk about HUD's priorities. Generally, HUD indicates what their Nofo priorities are in 2 ways. One, by explaining the policy priorities that they want to achieve, and 2, by how they score applications. Next slide, please. I'm going to talk about the stated policy priorities in this Nofo, and at the end of this presentation, Christy is going to talk about scoring. So as you can see here, HUD is clearly stating in this section of the Nofo that they are looking for comprehensive community plans that will reduce unsheltered homelessness by connecting people living unsheltered and in encampments to housing and healthcare or behavioral health services. They're looking to build capacity and reduce unsheltered homelessness in rural areas, specifically addressing the unique circumstances present in rural areas. And what I mean by that is that projects can use the flexibility that they provide in this Nofo to rural projects on eligible activities. And I know Leslie's going to get into this a little bit in a little bit more detail, but on page 21 of the Nofo, HUD lists rural specific eligible activities like capacity building and repairs to make housing habitable that are specific to this to those projects. And then HUD is also specifically interested in providing assistance on tribal lands, including those areas that were in years past ineligible for COC funding, like trust lands and reservations. Next slide, please. HUD is also very focused on partnerships and an inclusive process. That means bringing partners like affordable housing developers, PHAs, and healthcare and behavioral health providers to the table. They're also talking a lot about how successful plans will center equity, as I just reviewed, including how the COC will reach and serve underserved populations and historically marginalized people who are more likely to experience homelessness. And lastly, using a housing first approach in this work. Note that HUD says correctly using a housing first approach in this Nofo. That this isn't about checking a box that says you are doing housing first, but implementing in a way that does not have fidelity to the evidence-based model. We're encouraging all applicants and COCs to understand successful housing first models and evidence and incorporate those policies and practices in your plan in robust ways. And then my last slide here, next slide, please. As you think about what you're going to apply for, it's really important to understand the funding caps and grant terms for each set aside. Again, Leslie will talk about this in more detail. I really wanted to put this up on the screen side by side with the unsheltered set aside so you can easily see what the differences are. The most important differences include that planning and UFA funds are only available in the unsheltered homelessness set aside, but hard costs are only available in the rural set aside. Again, Leslie's going to dig a little bit deeper into that. And with that, I'm going to turn it over to her to go through the details. Leslie, take it away.
Thank you, Anne. And I don't even need to say next slide. As Anne said, I'm with the Housing Assistance Council. I'm a senior policy analyst. I was going to look at where everybody was from and see how many people were from, or try to get a sense of how many people were from local organizations and local governments as opposed to COCs. But since I haven't had a chance to do that, thank you everybody for introducing yourselves now. Next slide, please. I'm not going to be able to focus on exactly who the right audience is, and I apologize for that a bit. Let me tell you a couple things quickly about the Housing Assistance Council. We work around the country, we nationwide, and we work specifically on rural housing and development. Next slide, please. We do a bunch of different things. We are a CDFI with loan funds. We do training sessions online and in person when COVID permits. We do technical assistance, policy research, and news and information. And if you work in anything close to rural housing and don't get our newsletter, the Hack News, I highly recommend it. You can sign up by going to, next slide, please, our main website, which is ruralhome.org, and there should be a box on the homepage that says sign up for Hack emails here. We also have two data websites, Rural Data Portal and Veterans Data, which provide data not only for rural places, but for the whole country in a highly usable way, I think. So I encourage everybody to use those. Next slide, please. So the real things, I'm going to repeat a bit of what Ann says, but I will try not to repeat too much. I'm going to talk about the rural set aside, not a lot of detail about the unsheltered part. The rural part is offering $54.5 million, and that translates into a maximum for each continuum of care that is listed in the Appendix A of the Nofo. There should be I'm not sure who's putting things in the chat. Caitlin probably has a link to the HUD page about this Nofo. There it is. Thank you. With information and resources, including the text of the Nofo itself and its appendices. Appendix A is a list of every continuum of care in the country and the maximum amount that it can apply for under both of these set-asides. COCs that serve rural areas can apply for either set-aside or both of them, depending on what projects you want to do. Next slide, please. The rural set-aside, Ann mentioned this also, has an emphasis on underserved places, which is a great thing. Making this funding available to places such as trust lands and reservations that have not previously been served by COC, the COC program. There will be lots of projects in other places that will be funded, I'm sure, but in the scoring process for individual projects, 10 points, which is a lot on a 100-point scale, can go to places that serve projects that serve places that were not previously served. Next slide, please. Thanks. One of the complicated things anybody working in rural areas has probably encountered is all the different definitions of rural, and the rural definition for this funding, which does not track rural definitions for other things like USDA rural housing programs, is complicated, but it's based on counties. And so HUD made this very easy by just listing the counties that are eligible for the rural set aside in Appendix B of the Nofo. Again, this isn't exclusively for rural areas. This is, I'm talking specifically about the rural set aside, but there is the unsheltered set aside, and that places applying for that do not need to meet the rural definition. Next slide, please. The rural set aside, as Ann said, has more activities that can be funded, a wider variety of things you can do with this money. One of the particularly notable things is that capacity building activities for local organizations or government entities can be included. That's about 2/3 of the way down on this list. There's also all these other things, including actual hard costs that can be covered with the rural money that cannot be covered with the unsheltered. Next slide, please. There are a couple of specifically ineligible activities under the rural. Next slide. And the definition of homeless, which is the people that can be served with these with this funding, is also broader for the rural set aside than for the unsheltered. It includes people who are literally homeless, living on the streets or in their cars or wherever, people who are precariously housed, domestic violence victims, and in certain situations, youth or families, with some limitations on that one. This is a great recognition of the differences in rural homelessness as opposed to homelessness in big cities, where if you're homeless, you may not have, if you're homeless in a rural area, you may not have a shelter to go to, so you may be what's HUD is calling precariously housed, living doubled up, sleeping on someone's couch, something like that, where technically you have a roof over your head, but you're not, you don't actually have a home of your own. And I probably don't need to be telling folks who actually work on rural homelessness about this. Next slide. Thanks. Either set aside under this Nofo has to include a plan. The COC's application to HUD needs to include a plan. The rural plan doesn't have to include some of the specifics about plans for unsheltered homeless services, but both plans have to, in a plan under either set aside, has to include how you're going to address severe service needs. And there's a pretty long list here of things that are considered to be severe service needs. So you can be focusing on any or all of these. Next slide, please. The scoring for this, I'm going to say, I apologize if people already know this, but I'm going to back up a second and say how the different steps in the application process. Local organizations, nonprofits that are housing or service providers, and public housing authorities and local government entities or regional government entities within a state apply to a continuum of care for a specific project or projects. The continuum of care ranks and scores and ranks those applications and puts them into its application to HUD. And then in this particular rural set aside, HUD is going to do something it doesn't usually do and won't do in the unsheltered set aside of this Nofo. It's going to score the individual projects. That's where those 10 extra points that I mentioned come in, so that the continuum of cares ranking matters a lot. That's 40 of the points, and then 50 points for each project depend on how HUD scored the COC's overall application. And then because HUD is going to look individually at projects, it's going to be able to implement this focus on places that haven't previously been served. Next slide, please. If you aren't familiar with this process already and you aren't a COC, you're going to need to find your COC in order to take advantage of this. I was on a HUD webinar yesterday about this Nofo. A bunch of you may have been also, and someone from HUD said continuums of care cover 95% of the US. I'm not sure if that's 95% of the people or 95% of the land area, but either way, I'm going to guess pretty safely that the 5% that aren't covered are probably rural. And so there will be places where you may need to back up and start thinking about creating a continuum of care. And obviously that's not going to happen between now and October 20th, but you may want to look at that for the future if you end up in one of those places. The way to find the grantee for your area is to go to this website, which you can also get to, there it is in the chat. Thanks, Caitlin. Click that will help you find grantees under a bunch of different programs. So you have to choose continuum of care, and then you choose your state, and you may or may not see your town or city or county listed as in the name of a continuum of care, but there are balance of state continuums of care. Maryland, where I live, has 17 continuums of care, which is, it's got a fairly substantial population, but it's not big, not a big state physically. But there are a lot of separate continuums of care, but there is also a balance of state COC. So if you look at the list for Maryland and you don't see your county or town listed, then you go with the balance of state COC. Next slide, please. So there are the schedule that Anne showed earlier looks kind of daunting because the deadline for most continuums of care is September 20th at the latest for people to present applications for projects to the COCs, and then the COC has to score them and rank them and put their overall application together and get it to HUD within the next 30 days after that, submitting it by October 20th. But it's worth it to try to connect with your COC if you're a local group, or if you're a COC yourself, to try to connect with the local groups or the PHAs, because of all the special things about this Nofo that we've been talking about, which are repeated again on this slide. And next slide, please. It's always useful to build partnerships. So even if you contact a COC and they say, oh, geez, we can't get our act together to apply for this, but you sure have an interesting idea for a project, then you might be able to work with them in the future. There's also the possibility of getting stability vouchers, which Eric is going to talk about in a minute after I give him a chance to talk. And there will always be a continuum of care competition coming up next year. This funding happens, not this specific rural and unsheltered set aside funding, but general COC funding happens pretty much every year. And there may be opportunities to partner for who knows what other things that would help everybody meet their missions and serve the people who need to be served. Next slide, please. These are some links. I think you may have gotten all of these in the chat by now. The email address, Anne mentioned at the top of the webinar that HUD has an email address for questions, cocnofo@hud.gov. They have one that's even more specialized for this particular Nofo, which is special cocnofo@hud.gov. And notice that it's Nofo with an O, not an A. Nofa used to be the term, but now it's Nofo, just to confuse everybody. But they can help, for example, figure out what continuum of care you ought to be communicating with if you can't tell that from the continuum of care thing, as well as other you know, the whole range of questions that you might have about this Nofo. And I think that is the end of my presentation. There's if you're into scanning things with your phone, that's a link that will take you to HAC's information sign up. And I will turn it over to Eric. And I look forward to answering questions later.
Great. Thanks so much, Leslie. And before I get started, just a big thank you to Leslie at the Housing Assistance Council and Ann and Christy at National Alliance to End Homelessness. We're really happy that we get to come and join all of you today on this important webinar on the special Nofo and also stability vouchers, which I'm going to talk a little bit more about. For those of you that aren't familiar with NARO, though, we are the National Association of Housing and Redevelopment Officials. We were established back in 1933 and are a member organization that represents more than 19,500 housing and community development providers and professionals throughout the United States. A large part of our membership, though not all of it, are public housing agencies. And so for our membership, stability vouchers are a new exciting thing coming out of HUD. And they're really tied closely to the special Nofo that Leslie just walked us through. And I'm going to talk a little bit more about how these are tied together. Next slide, please. But just before I really jump in, my name is Eric Oberdorfer, as Ann mentioned earlier. I'm the Director of Policy and Program Development here at NARO in Washington, D.C. Next slide. Great. So back on August 16th, HUD issued PIH Notice 2022-24. And what that notice did was walk through HUD's non-competitive allocation strategy for these new stability vouchers. So what are these vouchers? Well, essentially in fiscal year 2021 appropriations, Congress set aside around $43 million that would be used as new vouchers for public housing agencies. But these vouchers would be specifically tied to individuals experiencing homelessness, and really particularly in two areas. So areas with a high incidence of unsheltered homelessness and in rural areas. So again, very close, or not very close, but exactly what that special Nofo that Leslie walked us through is focused on as well. But instead of being at the COC level, we're talking at the PHA level. And so that 43 million that HUD announced on August 16th represents about 4,000 new vouchers that are coming into the program. Next slide. And there's a two-step process that I'm going to talk a little bit more about as it relates to HUD actually allocating these vouchers out to public housing agencies. First, PHAs that are interested in the stability vouchers that meet the requirements associated with the stability vouchers should register their interest with HUD by October 20th, 2022. Once agencies do that, there are a couple of things that HUD's going to look at that I'm going to talk about more in depth in just a minute. But if the PHAs that have registered interest meet the qualifications and are in the right priority categories, then HUD would invite those selected PHAs to apply for a specific number of stability vouchers moving forward. So again, right, the first step is registering interest in the stability voucher program. The second step would be hearing back from HUD saying, we're inviting you to apply for X amount of vouchers. Next slide, please. And for those of you that are familiar with the emergency housing vouchers that came out during the pandemic, these stability vouchers really are similar to the emergency housing vouchers, though they are different. But really the biggest component of this that's shared between stability vouchers and emergency housing vouchers is that PHAs who receive them need to have a partnership with their local COC. Again, these vouchers, right, are aimed at helping individuals experiencing homelessness or at risk of homelessness. And so there was a decision made that in order to really target these vouchers to the populations that Congress wants them to be targeted to, there needs to be a partnership with the PHA and the local COC. There's some additional considerations with that for the stability vouchers that weren't included with the emergency housing vouchers, which I'll talk about in a minute. But for the most part, it's that partnership that's really kind of the critical piece of this voucher program. Emergency housing vouchers and stability vouchers serve similar populations. So again, those experiencing homelessness or at risk of homelessness, those fleeing or attempting to flee domestic violence, dating violence, stalking or sexual assault. And then this additional category for veterans and families that include a veteran family member that meets one of the preceding criteria. So again, there are a lot of similarities between the emergency housing voucher program and stability vouchers, but I want to make it very clear at the onset of this that they are two different programs with two different pockets of money. Next slide, please. So again, just some of the differences. Stability vouchers were funded through the 2021 Appropriations Act. I know we're already getting close to the end of fiscal year 2022, but it took HUD a little bit of time to figure out the program. But we were happy to see in August when they made the announcement that they were starting the process to release these vouchers. They have their own set of statutory and regulatory waivers the public housing agencies can use that, though similar to what was included with the emergency housing vouchers, do differ slightly. And really those statutory and regulatory waivers are an acknowledgement that this is a harder to house population that the stability voucher is hoping to help. And as a result, it gives some additional flexibilities to public housing agencies just to make it easier to lease up these vouchers and provide a little more time to make sure that families can find adequate and appropriate housing. Next slide, please. So again, right, and this is where stability vouchers come into the larger picture, the larger conversation that we're having today on this new Nofo that's come out of HUD. These stability vouchers really are intended to work in collaboration with that Nofo. So the way HUD is doing this is they're essentially prioritizing the agencies that they'll invite to apply for vouchers once they receive those registrations of intent. The first prioritization category are agencies that are able to partner with a COC that has won an award under this new Nofo. So again, right, these stability vouchers are really oriented toward helping individuals at risk or experiencing homelessness in rural areas and areas that have a lot of unsheltered homelessness. That's why they're tying it back into COCs that are receiving funding under the new Nofo. It's really looking toward the same types of locations and same populations. If HUD goes through and there's still money left over, and every single agency that has submitted an application with a partnership with the COC that's received funding under this new Nofo, then HUD would go back and consider PHAs that are partnering with a COC, but with a COC that didn't receive any funding under this new Nofo. So that's only if there's money. That's that second category for prioritization. But really, I think what HUD is hoping is that they'll be able to use all of these vouchers at agencies that have partnerships with COCs that are earning funding under this new Nofo. So that's just like emergency housing vouchers of the biggest component of these stability vouchers. You cannot receive them if you do not have a partnership with your local continuum of care. Next slide, please. One of the things that PHAs are going to have to do when they submit and they register their interest via email to HUD is they're going to have to attach a letter of commitment between them and their local COC. So what that letter needs to do is demonstrate that PHAs, along with the COC, have developed a strategy in collaboration with the community. So you need to be able to show to HUD at the time you register your interest in these vouchers that you have a partnership with your local COC. There's also a memorandum of understanding requirement, which I'll talk a little bit more about in a second. I want to note, though, this MOU is not due at the time that PHAs need to register their interest, which is October 20th. So you don't have to have the MOU in place by October 20th. You just need to make sure you have that letter that has a commitment between the PHA and the local COC to work together to get these vouchers leased up. And really what that letter is going to walk through is the different responsibilities of the COC and of the PHA. And I think the easiest way to think about it is that the COC is responsible for finding the households and the families and determining that those households and families are eligible for the stability voucher. Once the COC has determined that, they can then refer the household or the family over to the PHA, and then the PHA will come in and help with leasing and making sure that that stability voucher can be put into a unit so that the family can receive housing. Next slide, please. The MOU, though, does have some specific things that need to be included. Again, this won't be necessary for the October 20th deadline, but will be necessary at some point during the application process. So within that MOU, you must make sure that the PHA, the COC, and the VSP or veteran service provider, if you're dealing with a household that's a domestic or that has experienced domestic violence or abuse, there needs to be a commitment between those groups to administer the stability vouchers in partnership. There also needs to be included the goals and standards of success in administering those stability vouchers, the staff position for each organization that will serve as the lead stability voucher liaison, a listing of COC funded support services that the COC will be able to pair with the stability vouchers for the families that are using those, any alternative waivers that are adopted by the PHA for the administration of stability vouchers. There are additional flexibilities included with these stability vouchers, as I mentioned. I'm going to walk through what HUD has already written out explicitly PHAs can do in terms of statutory and regulatory waivers for using their stability vouchers. But PHAs can also determine and apply for additional waivers from HUD if they think those are necessary to get these stability vouchers leased up. So you would need to include those in this MOU. Next slide, please. Any permissive prohibition policies need to be in the MOU too. What that means, and I'll talk a little bit more about this, is basically what admission policies you're putting into place that might prohibit someone from accessing a stability voucher. There are certain things that PHAs must do. There are certain things that PHAs can do, and then there are certain things that PHAs cannot do in terms of prohibiting access to stability vouchers for families. I'll talk a little bit more about that in the details in just a minute. Outline the roles and the responsibilities of the PHA and the COC, including that whole referral process. And then a statement that all parties agree to cooperate with any kind of HUD evaluation or oversight, which is standard for a HUD agreement and contract. So again, right, what's really critical for these stability vouchers is that the PHA needs to be working in partnership with their local COC in order to find families to lease up and make use of these vouchers. Next slide, please. So again, I just to reiterate this and highlight this, I think this is something important to know. It makes the application process slightly more challenging. But if you think back to the deadlines that were mentioned about the Nofo coming for the COCs, right? October 20th was mentioned too. What that means is that if you are a PHA and you're interested in applying for stability vouchers, you'll still have to get that letter of commitment from your continuum of care, but you will not know by October 20th if that continuum of care was selected for the special Nofo. What does that mean? What it means is really you don't know if you're going to be in the first priority category or the second priority category when you submit your intent to register to HUD. Doesn't mean that you shouldn't go ahead with it, but it does mean that there may be it's going to impact when HUD looks at where they would fund you with vouchers, whether or not you fall into that first category or second. Next slide. Again, it's a two-step process. So that October 20th date is just letting HUD know you're interested. I'm going to talk a little bit more about what exactly needs to be in this register of interest. And then once HUD receives those, and again, once HUD most likely makes the awards to the COCs through this new Nofo, then HUD would determine which PHAs they would invite to be a part of the stability voucher program, and then also provide the specific number of vouchers that the agency should apply for. Next slide, please. Within that registration of interest, you're going to want to send an email to stabilityvouchers@hud.gov. Within the subject line of that email, stability voucher registration of interest with your PHA code. In the email, identify the name of your partnering COC that's serving your geographical area, and then include that letter of commitment from the partnering COC that's indicating their commitment to refer eligible families to the PHA through their coordinated entry system. Walk through what COC funded supportive services are going to be made available for families that receive a stability voucher. And then if there's any other collaboration with other stakeholders to develop a prioritization plan for stability vouchers. Next slide. So one of the things too that HUD's going to be looking at, so not only do they have this initial prioritization where you have PHAs that are partnering with the COC that have received funding through this new Nofo being the first prioritization category, the second prioritization category being COCs partnering with PHAs when the COC did not receive this new funding. Even within that, HUD's going to break it down a little bit too, just to try to make sure that these vouchers are really targeting areas with the most need. So what they're going to do is look at additional data to try to rank the applications for the PHAs applying for these stability vouchers. One of the items will be the prevalence of homelessness and families at risk of homelessness within a community. And then the second being the Pha Administrative Capacity. So what does that mean? Well, next slide. So what HUD's going to be looking at in terms of determining homelessness in an area, 2020 COC point in time homelessness data. They're going to take that data and then try to focus it specifically on the PHA geographic area as much as possible. For determining if there's a large at-risk of homelessness population, HUD's going to look at data from the American Community Survey on rental households that have incomes at or less than 30% of area median income. Overcrowded units, the number of overcrowded units within an area, the number of units without complete kitchens, and then also households that are severely rent burdened, meaning that they're going to be looking at households where the family is spending half of their income on rent. So that's how they'll determine the prevalence of homelessness and at risk of homelessness within a geographic area. Next slide. In terms of PHA administrative capacity, what they're really looking at is making sure that there are no major unresolved program management findings from either Inspector General HUD management review or an independent audit for a PHA's Housing Choice Voucher program, making sure there are no other significant compliance issues that the agency is currently up against, and then ensuring that there are no outstanding civil rights matters that PHA needs to take care of moving forward. Next slide. Just as a note for public housing agencies that are listening in, there are two additional requirements. You need to have a housing choice voucher program already. HUD will not award these vouchers to a public housing agency that does not already have a housing choice voucher program. And then PHAs must also have a consolidated annual contributions contract for that program. So those are two additional things that PHAs applying for stability vouchers need to have in order to be eligible. Next slide. As I mentioned before, and I want to be cognizant of time here, but there are a lot of statutory and regulatory flexibilities that are included within this notice that HUD put out for the stability voucher, these stability vouchers. You can find more of this in PIH 2022-2024. But essentially, what the notice does is walk through different waivers that help public housing agencies deal with waiting list management and preferences, making it so that they can have separate waiting lists specifically for stability vouchers, providing a little bit of guidance on how agencies can go through their existing voucher wait lists and identify families that they can move over to the stability voucher wait list so that we can get these vouchers leased up as quickly as possible. Additional flexibilities for documentation for eligibility and income. A lot of this really stemming from the fact that with the population these vouchers are trying to reach, sometimes it takes a little bit more time to do income verification, to do all of the steps necessary that PHAs have to do to determine what the rent will be for the family and to make sure that they're actually eligible for the program. What the flexibilities in Notice 2022-24 do is really say you can get the family housed up, the family can self-certify all of these items that HUD needs information on. And once the family is actually housed, then the PHA can start finding the proper documentation within a certain time frame to get to HUD. So it makes it a little easier if you have a family, they find a unit and you can get them leased up. You don't have to go through all of the hoops right at the beginning. You can get the family housed up more quickly. There are additional flexibilities for payment standards and search times. Essentially, with these stability vouchers, PHAs can go up to 120% of their fair market rent as they establish their payment standards. again, to help try to find housing for families using these stability vouchers. PHAs do have the ability to go above 125% of their fair market rent in determining their payment standard for the stability vouchers, but they would have to get HUD approval for that. One thing to note is that the payment standard for the stability voucher cannot be less than what the payment standard is for housing choice vouchers within the agency. The other thing to note is that it cannot be less than the payment standard for emergency housing vouchers if the agency has emergency housing vouchers. Search times can also be extended up to 120 days. The PHA has the ability to make that even longer if need be, but the minimum search time for the stability voucher would be 120 days, unless the PHA has an even longer search window. If they do that, though, they would need to update their admin plan to reflect that. There's additional inspection flexibilities, which essentially say, a PHA can go out and do pre-inspections on available units as they're starting to get their stability voucher program up and running. So long as a family moves into that unit within 45 days of when that inspection occurred, that works for the stability voucher. One of the things, though, to note is that you can't require a family to move into a pre-screened unit, right? It's still up to the family to find a unit that they think works for them. But if you do have pre-screened units, that can make it helpful for the family, especially if you're in a really tight rental market or dealing with supply issues. And then lastly, as I mentioned, there are some additional admission prohibitions. Really, the mandatory one is similar to what is there statutorily for public housing and the voucher program. So if you have anyone that is been implicated on a drug-related criminal activity related to manufacturing or producing methamphetamines, or if they're subject to a lifetime registration requirement under a state sex offender registration program, mandatorily prohibited from the program. But aside from that, right, there are a couple of permissive prohibitions that you could put into place, really kind of related more toward violent crime or abusive or violent behavior toward PHA personnel. But those aren't required to put in as potential prohibitions for families using stability vouchers. And then I think too, what's important to note is there are certain actions that are prohibited from PHAs to use as a mechanism to deny a family from being eligible for a stability voucher. That includes if the family's already had a prior eviction from a PHA, if they owe any rent or other amounts to the PHA, if they've not, if the family hasn't reimbursed the PHA for amounts paid to an owner under a contract for rent, damage to the rent or other amounts, or anything related to potential prohibitions under alcohol abuse standards, or if the individual has been involved in drug-related activity outside of producing and manufacturing methamphetamine. So there are additional prohibitions that PHAs cannot put into place. And again, really, right, what these vouchers are trying to do are make sure that individuals that are either homeless or at risk of homelessness are able to use this voucher to help find permanent, stable housing for themselves. Next slide, please. So just as some key takeaways, right, for those of you familiar with the emergency housing vouchers, they're similar, but they are different, these stability vouchers. And I think most important to this, PHAs have to work with their COC in order to access these vouchers. And again, that top priority is going to be for PHAs that have a COC that has received this new funding from this Nofo. So really trying to target these areas that are rural and areas that have significant unsheltered homeless populations. Again, with these vouchers, they'll follow typical HCV rules, except for those waivers that I noticed that were included in PIH 2022-24. I think with that is my last slide. So Christy, I will pass it back to you.
Great, thanks, Eric. I'm going to hand it over, sorry, to Q&A. So if all the panelists could come back on, that would be great. And I am actually going to stop my share. And actually, Anne is going to kick us off with the first question while I dig through the chat and some of the other Q&A. Anne, you want to start us off?
Yeah, sure. Thank you all so much for putting these really good questions in the Q&A box. The first one that I'm going to note is it was much earlier up in the scroll from someone named Melissa. And she was talking a little bit about the fact that their local PHA turned down emergency housing vouchers because of the administrative burden being too high. So she was looking for some suggestions from the panel about how they can encourage their housing authority to work with them around these new voucher resources. Do folks have some ideas about what Melissa and others can do in those situations?
Yeah, I can jump in. I think this is something that we've heard from a lot of our members when the emergency housing vouchers came out. We know that there are some PHAs out there that have incredible relationships with their COCs. They've been working closely together. Having that partnership already there, obviously, is going to make it a lot easier to figure out what the best relationship is with your, COC or PHA when accessing these vouchers, both the emergency housing and vouchers and the stability vouchers. I think for agencies and for COCs that really haven't built that partnership yet, I kind of think of it as, whenever you're working, even though we're all doing housing and we're all focused on making sure that these populations have access to safe homes, right? Just the way sometimes the structures of the federal government operate, we can live in these little silos. And the first step is always going to have to be breaking those down and reaching out to either your COC and PHA and just really getting a better sense of what is it, that is potentially the concern of having these vouchers. What can we do as the COC to help potentially find additional units? I think right now, what we've heard from our members that are involved with the voucher program is, as we all know, with inflation being what it is and with markets being as tight as they are, it's really challenging to lease up units at this point. And so any kind of steps that a COC can offer to help a PHA with that are going to be really appreciated. But I think just making sure that those initial conversations happen so you can start building a stronger relationship between the COC and PHA is going to be really critical. There wasn't always necessarily a very explicit need for that, but I think what we're seeing coming out of HUD right now is an acknowledgement that there is a benefit to these partnerships. And so starting that conversation early is always helpful. And then hopefully that will lead to, what can we do in order to apply for these vouchers and make sure that we can utilize these.
Any other thoughts on that, Leslie, or I would just offer as well that sometimes it's really helpful to get your elected leaders involved in these conversations so that everybody in the community is sort of on the same page about what resources go where and how they can support from their elected leadership positions the PHAs and the COCs in the efforts to end homelessness in their communities, because that definitely is something, as Eric was mentioning, is like on the mind of a lot of elected leaders nationwide. So Christy, you want to go to the next one, or do you want to?
Yeah, no, that's great. Thank you. So one of the questions is, how long do the stability vouchers run once allocated to a household or an individual? Anybody know?
Yeah, that's a good question. It is done through annual appropriations. So, and this is kind of where we are right now with the emergency housing vouchers, I think, is waiting to see how really Congress is going to continue on the program or what's going to happen with these vouchers, if they're going to stay outside of the normal voucher program, if they'll be kind of absorbed into the program. But I think that's a good question, where especially with these very specific special purpose vouchers, typically what we hope is to see them renewed every year moving forward. But again, that always comes down to decisions made by Congress.
I'll just add one little nuance to that, because I think it is an important question. Unlike the EHVs, which actually, because of the way that they were included in the COVID recovery funding, the EHVs actually have some time limitations because of the vehicle that was used to fund them, that are not applicable in the same way to these stability vouchers. So as Eric mentioned, we hope to see them, just like every other normal housing choice voucher, we hope to see them renewed annually through the appropriations process. But there is not the same kind of time limitation as with the EHV program. Did I get that right, Eric?
Yeah.
Great, thanks, Ann. There was another question was in the chat. It was around budgets and how to help build the capacity of organizations that are looking to either apply for new projects, help them build out their budgets. And one way we've seen communities do that with the regular COC competition is often to find a similarly situated COC and look at past years' project applications, which are typically should be posted on COC websites, to find how they built out those project application model budgets, and then connect with those organizations and those COCs to have some conversation about what would a rapid rehousing budget look like, or supportive housing, or whatever the particular project component is that you're looking to fund. So no need to recreate the wheel. Their project applications actually are already out there. But does anybody else want to offer that or offer any insights on that? Leslie, I don't know if I know you've kind of followed up in the chat on that. Did you have anything you wanted to add?
I'm not aware of a way to get funding. You might be able to get funding reimbursed for the time you spend building out your budget, if you can put that under staffing costs or overhead or something like that. But I don't know of a way that you can actually get funding
To build
in
up.
advance to build out a budget and plan out your project before you have the funding to do the project.
Right. Well, upfront costs, it sounds like.
Right.
Yeah. There's another question here about the MOUs and letter of interest. Are there templates out there that are available that communities can access?
Yeah, I would recommend that notice, PIH 2022-24. I believe there are some appendices in there that can help with that.
Right.
Less so, I think, with the letter of commitment, usually that's a little more open-ended. It's similar to the EHV process, but really what HUD wants before making any selections for the stability vouchers, they want to make sure that there's that agreement. Obviously, the MOU is going to be the more formal not contract, but agreement between the COC and the PHA. But yeah, I would look to the notice, which Caitlin just put in the chat. Thanks.
Great. There's a question here. As a PHA and a housing finance agency, we'd like to leverage our portfolio to project base our anticipated stability vouchers. Any suggestions for a PHA trying to balance finding willing properties that are sited in areas served by a partner COC? I feel like it's almost a chicken and egg scenario.
Yeah, I mean, that's a great question. And I know this is a challenge that a lot of agencies are facing right now. One of the things that I didn't mention that's included within Notice 2022-24 is it does talk about the ability for PHAs to basically project based with these stability vouchers if they're able to, without necessarily receiving prior approval from HUD. But I think there's always the challenge, right, of how much to project base and what makes the most sense, right? I think the challenge that we're seeing just in general is the fact that there's just a lack of housing across all communities within the country. And I think even in ways, in rural communities right now, we're seeing that suburban, urban, it doesn't matter where you are. And so you're exactly right with the chicken and the egg component of this. It's hard to figure out how to do that, but there are some additional flexibilities in the notice that allow agencies to think about project basing with these stability vouchers if it's helpful.
We have one last question, but before we do that, I see that there's a few comments in the chat about getting the chat file. And we'll go ahead and go through the chat file and kind of pull out some of this, I think, helpful information that people put in there. And we'll create a document that we can upload to our website along with a recording and the PowerPoint presentations. It might take us a little bit to do that, to kind of like clean up the chat, but we will pull out these helpful links and helpful information. So one last question, I think we've got about 1 more minute. And that is, could you please, let's see, can you expand on the waiting list management? You mentioned reviewing existing waiting lists to streamline issuance, but I thought the referral had to come through the COC.
Yeah, so essentially the referral has to come through the COC, but what the agency can do is look at that, at their waiting list that they have, or potentially share the waiting list. And I know this was something that was done with emergency housing vouchers. It's an easy way to figure out who might actually meet the requirements for these stability vouchers. So the COC would still be responsible for making sure the family meets all of the eligibility requirements, but it'll start you off with a pool of families that you can look to. And then in terms of having the separate wait lists, what you're able to do is create, instead of just putting these into your existing housing choice voucher waitlist, you can create a separate waiting list specifically for these families that are either, it would probably be before the COC referred them, because once the COC refers them, right, they would have their voucher and be able to go out and use it. But it does make it so you can really easily identify which families would be eligible for this program, and help the COC in terms of finding the exact families that you know are already looking for housing and already have reached out to the PHA. So again, the referral does have to come from the COC, but you can use the existing data you have within your wait list at the public housing agency to help that process.
Great, thanks, Eric. Well, it's 4:15, and I just want to end by thanking everyone. And I just want to echo what Mr. Blackwell said in the chat, which is, I live for this stuff. I know that all of our panelists do as well, and many people in this chat. So thank you so much for spending the afternoon with us. We've enjoyed our time together, and thank you to the three of you for your time. And recording, PowerPoint, and the chat info will be up on our website in the next couple of days, and you will get an email telling you that it is up. So look for that email in your inbox. Thanks, everybody. Have a great day.
Thank you.